Hi, Dr. Milky back with another message about plantar fasciitis. One of the scenarios I see probably about at least 20% of the time when it comes to pain in the heel and this plantar fasciitis diagnosis is someone who will come in and say, I'm having pain kind of around the back of the heel. Here's the heel bone. This is the inside of the heel. This is the outside of the heel. And they'll say, they'll point to around the back of the heel and then land kind of on the outside of the heel. Like when I'm walking, I feel the pain out over here. And they won't necessarily say something about the bottom of the foot where the plantar fascia is, although it might have started there. But now I call it the rim, kind of around the rim of the heel, and then it lands towards the outside of the heel. So what is that? Is it plantar fasciitis? Is it not? And I can tell you that in most cases, it's when the nerve gets involved. And you may have heard me talk about nerve pain that people get sometimes at the same time they get typical plantar fasciitis symptoms, or sometimes after they've had plantar fasciitis symptoms for 3 months, 6 months, 9 months, a year. The nerve can get pinched, and the nerve typically gets pinched here on the inside of the heel. So if I press over here, oftentimes they'll have pain. What's interesting is that I'll press here, they'll have pain. I'll press on the outside of the heel, they won't necessarily feel anything, but when they're walking, they will feel it on the outside. And that's because they're compensating and the nerve is getting pinched. So if you're having pain around the rim of the heel or the outside of the heel, and maybe not quite as much on the bottom or some on the bottom, it's oftentimes this nerve scenario. And again, the main thing is the diagnosis has to be correct. Otherwise, the treatment isn't going to be right and you're not going to get better. We'll see you next time.